we are honored to welcome our honorable guest. What inspired you to choose medicine as a career that you will work as with NATO and the European Union?
To be honest, patient is patient. They have special risk, they have special tasks. It's the only organization in the world at the moment. A lot of European nations thought we should not repeat this mistake. Free trade and free business. As a multinational doctor, I think I have at first to think about this was really something for everybody new. And
what are the biggest changes you have observed in healthcare between the pre-COVID and the post-COVID eras?
You are absolutely correct.
AI and digital tools will replace doctors.
Radiologists might have problems in the future. This I see as a danger.
All these things will replace with AI. Do you think? Why is prevention often neglected compared to treatments? What simple changes can countries like Kyrgyzstan?
Your Kyrgyzstan state and the World Health Organization a program. People are good surgeons or not? Yeah, they are the cream on the coffee. This is, I think, the most important issue. Study more. This is a very artificial question, to be honest.
What impact do you see here right now and you think in the future?
Physicians can give up learning.
One word to describe medicine. Coffee or tea? Have you tried Kyrgyzstan? In your opinion, most important skill for a medical student in 2026?
Why you are laughing?
AI in medicine, opportunity or risk? Field mission or hospital? What advice you give to the students? Welcome back to another episode of MedCast KSMA. I am your host Yaman Muhammad, and today we are honored to welcome our honorable guest, Dr. Stefan Kowitz, a highly experienced physician with over 45 years experience in medical service, including working with Bundeswehr, NATO, and the European Union. He is an expert in military medicine, public health, telemedicine, and also emergency healthcare system, and currently serve as a senior scientific advisor at Semmelweis University in Budapest. Welcome to podcast, Dr. Stefan Kowitz.
Thank you very much for your nice introduction. I would like to correct a little bit. I was advisor. I'm now retired. And now I'm working for the Senior Expert Service in Germany. And they have a cooperation and they're looking for experts. And your university requested my visit. And other physicians also have done similar tasks on different disciplines.
Thank you so much for increasing our knowledge about yourself. Dr. Kowitz, to begin with, could you tell us a little about your journey and what inspired you to choose medicine as a career?
I must be honest, in Germany, sometimes it was not difficult when I was young to study medicine because our study places are limited to the training places for anatomical studies. Every student has to do 2 semester study on cadavers, and 6 students are working on 1 cadaver and have to prepare nerves, vessels, and all these things, the muscles. And in this way, only depending on the cadavers, we have limited people. When I was young, I saw in my family some diseases, and this made me the feeling it would be a good starting point to study medicine. And I did some practice in a hospital as an assisting nurse, and therefore I decided to do it. And later on, I think I took the right decision.
Looking back at your journey, early days as a medical student, did you ever imagine your career will become an international, that you will work as with NATO and the European Union?
No, in the beginning I was focused to be only a general practitioner, and I was proud to take this discipline because it's such ambitious and also interesting task to be a physician dealing with family issues, with also sometimes diseases which are related to the family environment and also to the occupational environment. So in this way, I was very happy to get my study and my special exams and my training as a general practitioner. And therefore, I was very happy to do this. But then suddenly somebody asked me to do other things.
Then there is one question came in my mind. Then why you choose military medicine?
Yeah, these double tasks to be an officer and a physician. This, I think, was the challenge issue. And this was a reason I thought that might be more interesting. And I saw also when I was doing a lot of weekend emergency call duties, that a lot of my colleagues, after 20 years as a general practitioner, were burned out. And I saw the chance in the Bundeswehr that I have more different challenge tasks which make my life and my working environment more interesting. This was the main reason to go as a military officer and physician.
Okay. You have worked as a normal physician, general physician, and also as a military medicine. So what difference you seen between both of them?
To be honest, patient is patient.
Yeah.
There is no difference. The only difference that the soldiers are a very specialized population, and we could have also more benefit if we would use this knowledge, this weakness in our system. I know other armed forces do it better, to collect the special data of soldiers. They have special risk, they have special task, they have special training. For instance, a parachuter or somebody who is going on a naval ship, they need different conditions and preparations.
Okay. You also have worked with NATO and the European Union. How was your overall experience there?
First of all, I must say, a lot of people in the public say NATO is dead. This is wrong. It's the only organization in the world at the moment which is able to start immediately a command and control function for a mission abroad, independent of a disaster or of stabilization mission like it was in Afghanistan, or for a defense of our NATO member countries.
Thank you so much, because it's one of the great information. Can you share your one memorable journey in the NATO or in the European Union?
Okay, European Union is another entity which is for Europe very important, because since we have the European Union, we have peace in Europe. It was, if you see, the First and Second World War. And after the Second World War, a lot of European nations thought we should not repeat this mistake. We should work together. And in this way, I think it was important to create the European Union. Now, it is very easy by the laws we develop that, for instance, a physician can work in Germany or next week in London as a physician, because we have similar regulation. Not now UK, sorry, the wrong example, because they left the European Union. But if I bring as an example Paris, or I would say Copenhagen in Denmark, yeah? So it's possible to exchange nurses, physicians, but also in other professions. We are flexible because we want to have free trade and free business, but with good regulations, with good laws. And this is the strong part of European Union. But in the same way, like in NATO and European Union, we have to find the consensus for all nations. And this is sometimes really hard to achieve. And you cannot imagine how sometimes nations can be very different in their thinking and to find a compromise. And this is sometimes very, very hard working. But in my area, I was often very successful to find the compromise, because we worked for the benefit of our patients. So regulations done for health, for military medicine, are mainly for the benefit of our patients.
Okay. So there one question comes that in your opinion, how cultural understanding when you are working as a multinational doctor?
As a multinational doctor, I think I have at first to think about ethical issues in not, I would say, in Europe. There's also some, we say Europe, the community and combined of regions. A French comrade is different than a German one. But if we are speaking now about missions abroad, if I go to Indonesia, if I go to other countries like Afghanistan, then I need also a lot of cultural respect and also knowledge. And I think this is important for the success in the international environment.
Yeah, thank you so much. My question was not correctly, but your answer gave very precious. You have been involved in emergency system where you like disasters such as earthquake and infectious outbreaks. What are the biggest challenge doctor face?
Okay, I must say COVID outbreak was, I think, for everybody a challenge.
Yes.
So I must say, and I said this morning, I had a short lecture in the Public Health Institute, that I must say this was really something for everybody new, and all reactions were not easy to take. We had not always scientific advices in such a way that our decisions were in the beginning always the best ones. So I must say this was, for me personally and also as a physician, the most challenging time. And I was thankful that we got the two game changers. First was good testing systems and very easy testing systems, which are strong in their indicators, and second, the vaccination. The other issue is, I must say, I was confronted into war situations in Afghanistan, and I must tell you, war is bad, and therefore I'm very thankful if we have peace, and I'm praying and saying peace is the best, and we hope we get more peace in our world.
Yes. Many students want to, because our mostly audience are medical students, and many medical students want to join emergency medicine, but some students have concept that emergency medicine is only rely on the hospitals, but we know that we have to go anywhere when nation call us. So in your opinion, what skills should a student develop if he wants to work in emergency medicine?
I think this is absolute known from the civilian military side, that emergency medicine, and especially the first 1 hour, is the most important time for a patient. So damage control resuscitation capabilities to make breathing airways possible, to provide, to stop catastrophic bleeding, to make sure that the patient get, if he has a hemothorax, he need, or a pneumothorax, that he get puncture. So all these measurements and skills you need to make for damage control resuscitation are important. Then the second step is to stabilize a patient for transportation, and then he can get into a pre-hospital or clinical care. So in this way, I think these skills to make somebody alive and improve his capability to get transported is a very important skill set. And therefore, I think it's a very nice and challenging, but also fruitful work.
Okay. So you have almost 45 years experience in medical profession. What are the biggest changes you have observed in healthcare between the pre-COVID and the post-COVID eras?
I mentioned in my lecture, telemedicine was not such a big issue in our country, in Germany, but also in the world. And after COVID, telemedicine, I think, is now more accepted and will also make his ways. I was in the 80s, 90s also involved in telemedicine, and I can tell you I was convinced that it's the right way, but then it was stopped because some physicians said, I don't need it, it's not helpful, I need the personal contact to my patient. But COVID made it necessary that we could not have a direct contact with our patients. And then a lot of physicians have seen it's working without direct contact. I prefer also direct contact, and there are a lot of diseases where you need it. But for some issues, it's very helpful.
You already explained, but I wanted to know about this. As a student, when we are studying, our teacher tell us that inspection, palpation, these basics are necessary for understanding the disease and everything in the patient. So how telemedicine will help in this profession?
You're absolutely correct. And I think before the therapy, the diagnosis is the most important step. And the most important step is to do an excellent examination of your patient. I don't want to change this. And if you have the possibility, and this is a precondition, that you have this chance. But to get second opinion, telemedicine might help you. It might help you to mentor a patient, whether he has taken regular his medication or whether he has now side effects. If you have a heart failure, it would be nice to know whether his weight is increasing or whether he has problems with breathing. So it's additional help. Yeah, you are right that in some cases, at first, this examination is necessary. But then in second steps, and we know it also for rehabilitation, you can make a lot of teaching to your patient by telemedicine. So it's always a mixture, but you're right, don't lose the contact to the patient.
Yes.
This is very important. And I must say also in my home country, a lot of physicians are not doing this examination. They only talk, make a decision, and have not really looked on the patient. So this is absolute important.
Yeah, because as a student, when we hear this, we say that we learned that you should examine patient, but how telemedicine will do it? So thank you so much. And now there is one controversial question between AI generating companies and the medicine. Do you think that AI and digital tools will replace doctors, or they will primarily support them?
This is a good thing that these, what you said, the examination, not a computer will do. But I must be honest, a radiologist might have problems in the future, because there will be, I think, artificial intelligence able to make an analyze from these nice pictures, digital pictures, and say, okay, this is not broken. And then there might be only that the machine is saying to you, there might be some problems that then a specialist will look. So a lot of regular examinations of a radiological picture might be done by artificial intelligence. This I see as a danger, as one case. I see also in some diagnostic areas that telemedicine might help us to make better analysis of sonograms, ultrasound. Yeah. So in this way, it will support us, make it easier, and I hope also to have more time for our patient. Yeah. This I should see it important to have more contact to the patient. So I would say you need always a physician who has direct contact, but you will have a portfolio of supporters by artificial intelligence. And to be honest, if you look sometimes in the possibilities of artificial intelligence, it's helping if you get a differential diagnosis, but sometimes it's really extremist. And then at the end, you need to decide. And then it's also your personal experience important.
No. Like if you talk about primary support, it will be like robotic surgeries nowadays, or you can say telemedicine. But now there is one controversy that in the future we don't need a doctors or surgeons for this, because all these things will replace with AI. Do you think?
No, I think that we might have support by robotics. Yeah, to have better surgery, you have to plan first your surgery. This cannot be done by a computer. You have to ask your patients about allowance. You have to explain him the side effects. I'm sure also no computer can do it in such a way. And you see it if you want to get in a emergency call, sometimes help, and you have an artificial intelligence, you're getting sometimes crazy because the system cannot react on flexible questions. Yeah. So I'm sure that we will really need in the future sufficient physicians, and it might be only reduce a little bit the burden, but I'm 100% sure in 100 years we will have the same amount of physicians necessary. Yes. Might be more.
Okay, we should necessary then.
You can, okay, I'm too old and that you can ask me. We can ask my daughter, she's a physician.
Yeah, I know about this also. You have focused on preventive healthcare system. So in your opinion, why is prevention often neglected compared to the treatments?
Yeah, this is an old story. If you look in the famous surgeons in Germany, Mr. Sauerbruch, who did great surgery, it was always that this management of diseases was very attractive. But in a very silent environment, the public health made it happen that a lot of diseases are now lost. Yeah, and I told this morning, only the easy thing to make hand washing is an important step for every physician and nurse. If I have examined a Polish patient, I have to clean my hands, not to distribute the germs and viruses. So in this way, I must say, it is very important to prevent diseases. And this is also cheaper. Yeah, if somebody is ill, it costs a lot of money to make him healthy or getting workable. Yeah, this is, I think, always our intent. If we want to treat people, they should work again and able to be a good part for the community. So I must say preventive medicine is one of our most challenged tasks in the future. And this will be also not done by artificial medicine. They might only support us. But at the end, you need people who push, for instance, that records are going to the right people. As said this morning, if a virus is popping up in a nation, makes more numbers, then you must be strong enough to report to the World Health Organization, or in your country you have to prevent and do measures. So I think preventive medicine is a very attractive and also nice story, but it's a little bit in a silent environment and nobody is seeing the importance so much.
Okay. So, what simple changes can countries like Kyrgyzstan and other developing nations implement to improve their public health and also prevention?
As you are aware, since 24, we have between your Kyrgyzstan state and the World Health Organization a program to show, to develop in some areas the public health. And as I learned in this report, for instance, your child deafness rate is downsizing, and you're trying now to make it more in the same way like other nations. So you're in a good way. You are one of the first Asian nations who have general practitioner education. You have implemented an emergency support plan. You decided for a triage card. So there are some excellent developments, I would say. In this way, I think if you're working in this direction, I think your state will be very successful. The problem is, like also in Germany, patients like to choose their physician. They don't want to go first to a general practitioner. They want to go to the specialist. This is the same in Germany. And this we have to learn from, for instance, the Netherlands. They have only the allowance that if you have visited a general practitioner, you can go to a specialist. And I know this also from other countries like Norway. So here I think, like in Germany, you are on the same level like Germany. Here we need sometimes more improvement, that our patients are directed more by general practitioners.
If someone wants to pursue his future in medicine and he wanted to know either he choose physician or surgeon side, so in your opinion, how he will choose it?
At first, if you are a surgeon, you need excellent hand skill sets. If somebody is not able to see the vessel and is not cutting I must say, there are people who have this hand set, yes, this skill set, and they are the ideal surgeons. And people who are not able to do this, they should not get a surgeon. Yeah. So I think in this way, it's also a special skill set that not everybody has. This you cannot learn. Yeah. People are good surgeons or not. Yeah. In this way, it's depending on these things. And if you are more a person who likes to work in the laboratory and not so much with direct patient contact, that's also good. Yeah. So it depends on your personal structure. What is the best discipline?
You have almost over 45 years experience in medicine. So in your whole this experience, is there any case which is memorable for you?
Oh, sorry, I know so much cases which are memorable. Therefore, I would not say. For instance, there was a very nice story when we had in the tsunami a birth, or when during an exercise in the Cape Verdean Islands. I must say the greatest present is from, I'm believing to God, but it's independent. I think it's the best present if you have a healthy baby and a healthy mother. This is the best and exciting moment you have.
In medical journey?
I would say medical. So, but I was not the right person for gynecologic and obstetrics.
Okay. There are many students, international students in KSMA. And so what advice would you give to the international medical students?
As I learned, it's not only in your country. If you go to Hungary, you see also a lot of foreigners who are studying at the Semmelweis University or the Pécs universities, and also in Czech Republic, it's the case. So I must say international students are they are the cream on the coffee, because they bring a good flavor, they bring new thinking and open the minds for the students. So I think it's a very important issue, and I'm very thankful that this university could increase the amount of foreign students and also supporting these nations, because they are providing a teaching capacity. So I think it's an excellent issue for everybody, for the students, for the university, because they earn also money, we must be honest. But in this way, I must say, is a very good win-to-win situation.
Okay. What are the best and most important qualities do you think in the doctor, academically and also personally?
I will start with personally. Here to your patient. This is, I think, the most important issue. And if you're not sure, ask the patient again. Don't be too fast and quick with decisions. Make sure that you understood the patient in the right way, that you are directed in the right way to find the right diagnosis. So this is, I think, the most important issue.
I think for this, you should have to train as a medical student when in the class you don't understand anything. So you should ask teacher again and again. So in future, it will not hard for you when you have to ask from the patients same question that I don't understand, explain again or something.
I would not say don't explain. You can make another question and asking, did I understand you right that you are thinking in this way? I'm not saying please repeat. I'm saying that you understand I have pain in my back. And then you have to ask him really, is it now dependent whether you breathe in or it's a permanent pain? So you have really to go more detailed in the hints of the patient. Yeah, I think this is so important. And therefore I said artificial intelligence will never do it. Yeah. So these are the most important things. And you asked now for the skills, no?
Yes.
Yeah, okay. You mean academically? Yeah, okay. You should have a good study. You should learn enough, but not details. You should learn how everything is getting together. Yeah, pathophysiology is very important for me, I think, and anatomic knowledge is important. So if you get these, and internal medicine is something I would say for a general practitioner are very important issues to be a good physician.
Okay. If you get chance and to go back into your past in your childhood or in a medical life, what advice would you give to your younger self as a medical student?
This question I couldn't understand. I should go in the past.
Yeah.
Okay, when I was young.
Yeah. And if you have to give any advice to yourself?
Study more. To be honest, I was not, and sometimes I didn't like to learn so much. To learn all the bones and all these things was sometimes hard for me. To be honest, later on when I was a physician, sometimes I said, why I have not learned? And then I had to do it, yeah? Okay. So what you not learn in your study, you have to learn it. It's necessary. Yeah?
So there is one question connected to this. Do you think if someone is not good in the medical study life, student life, he will become good doctor in future?
As I said, to be a physician is a combination of a lot of things. And as I said, if you are a laboratory medicine specialist, you are working different to your patient, and he can be also an excellent physician, but is not an excellent communicator. Yeah. So, or if you are pathologs, you're looking a lot of slides and checking, and are very important cause to decide whether this is cancer or not is so important for the future of a patient, but in a different way. Yeah. So I must say, for everybody who learned enough is a good place to be a good doctor.
There is one more question, same to this. There are two students. One is, he is brilliant in the study. And there is another student. He is good, not brilliant, but good in the study. But he is involved in extracurricular activities. In your opinion, who will be the best?
This is a very artificial question, to be honest, because it depends on the person. And I know what you want to say. Only looking for medicine is also not good. Yeah. And to be honest, this was the reason I said I had to be hardworking. I was very early married. We had early children. So I had also other tasks in my life beside my study. I had this chance to get earlier family. But at the end, you must work hard. You must concentrate on your study. And what you said, brilliant surgery, does not mean that the other one is also not brilliant. Yeah. So what is a good surgeon? Yeah. So it's very artificial. But you must be open-minded. Not only you are as a physician, you are a part of your society, and therefore you cannot ignore your environment. And at the end, your healthcare system is depending from political guidance, it's depending from insurances, it's depending from your nation. So if you ignore all these things and living in an isolated bubble would be not very helpful.
You aim to contribute to the Kyrgyz State Medical Academy, KSMA. So what impact do you see here right now and you think in the future?
Okay, at first I would say my task was sharing experience. And sharing experience is important. And I don't know whether my experience was worthwhile or not. This is a decision of the people of your academy. And at the end, I tried the best to be open and transparent in all my knowledge. At the end, I must say we have similar thinking, that general practitioners are very important and we should get good training for them, because good general practitioners are accepted by our patients and then they might be more used than now. So in this way, I could cooperate in this way. At the end, I have not decided. I tried my best and it's only 3 weeks, so I could only provide some ideas. And I'm sure if somebody else would come, he might bring other ideas. So it's a portfolio which your academy can choose.
Okay. You have spent almost weeks in the Bishkek and you visit a lot of different hospitals and departments of the KSMA. So what is your overall impression of the academy and its potential?
I must say I saw that you have excellent equipment, that you have there very dedicated physicians, that you have dedicated teachers and professors. And therefore, I must say I have a very positive impression of your university and you can be proud to be a student of this university.
Okay. Is there any advice which you would give to the future doctors? Here is the camera. You can.
Sorry that I hope I was not looking too much in your direction, that I made a mistake. Sure. We will see later on. To be honest, I must say my advice is learn all the time. A physician never can give up learning. And second, be happy that you have patients and can successfully treat or prevent diseases.
Okay, thank you so much. Finally, what is your overall feedback about Kyrgyzstan?
It's a very interesting, exciting country. I learned the abbreviation, the Switzerland of Asia.
Yes, it's known as Switzerland of Asia. Mm-hmm. Now, you have, if I am not wrong, you have 8 children.
Grandchildren.
8 grandchildren.
Yeah, 4 children and 8 grandchildren.
Okay, 4 children and 8 grandchildren. Do you think that these things affect your medical journey?
No, it was positive. And you see, one daughter got also a general practitioner.
Yeah, your one daughter.
And she wanted only to get a general practitioner. I said, make internal medicine. No, I want to be a general practitioner.
So what inspired you to join medical?
I think you asked me this question, so I will repeat it again.
Yes,
I said I got with special diseases contact. For instance, you should know my grandfather. He was the first person in Germany who got an artificial aorta because he had an aneurysma. And then he needed the dilution of the blood with Makoma in this period. There was some different stuff than now. They are now better. And so these examples of the disease of my other grandfather, this made me so interested to learn more from medicine.
Okay, thank you so much. Let's move to our quick rapid fire round. Basically, in this, I will ask you a question and there will be 2 options or your answer will be short. Okay, so first of all, if we ask one word to describe medicine.
It's an exciting and very interesting and challenging discipline.
Coffee or tea during your...
Tea.
Tea. You have tea. Have you tried Kyrgyz tea?
Yeah, every time. She is my witness.
One mistake which a student should avoid during their medical studies.
To give up.
Yes. In your opinion, most important skill for a medical student in 2026?
To be open, to be transparent, learning enough by different possibilities, internet or books.
Your favorite book?
Harrison, Internal Medicine. Why you are laughing?
I was thinking regarding stories or something. You directly prefer medicine? Any book.
Any book. Oh, that was a misunderstanding. Yes. I was thinking, which book? Last time I wanted to start, but I forgot the title in English. No, I have read a lot of. Last book was, for instance, a guide about Kyrgyzstan. Yeah, and this was a wrong book because it was from 24, but wrong advices.
AI in medicine, opportunity or risk?
What, sorry?
AI.
Yeah. No, as I said, it's a good possibility and it will help us. Yeah.
which will you prefer now, or you advise to the students, field mission or hospital?
Field mission.
Okay, finally, what advice you give to the students?
Okay, you asked me a lot of advices. I am not. I'm old, but not so old that I'm the Mr. But I want to give you advice again. Be healthy. Be nice to your family, and at the end, think always that you are thinking first about your patient. You are working for the patients, nothing else.
Yes. Thank you so much, Dr. Kowitz, for sharing your incredible journey and insight with us. You clear our concept regarding AI and doctors or medicine. And thank you to our listeners for stay tuned. If you like this video, don't forget to like, share, and subscribe this channel. We will meet you next time. Till that, take very good care of yourself. Let's the conversation continue. Thank you so much.